Welcome back to The Health Perspective, where we aim to have real conversations about our health and explore specifically how the way we relate to our health can affect our long-term well-being. So today I wanted to talk about something that I hear really frequently and kind of bothers me. It's a little bit of a cautionary tale, but also I think gets to the heart of stigma in mental health conditions and in their treatment. There's this idea that comes up time and time again when I'm speaking to people about their mental health. And it's the idea that taking medication for your mental health in some way makes you weak. And I guess coupled to that is the idea that medication in some way is an absolute last resort, or worse, that you're a failure if you need medication for your mental health. Let me give you an example to explain how this comes about in real life, because after all, we're most interested in having real conversations about our health here. Conversations that actually help us understand our health in a meaningful way. So, as an experienced GP, I look after lots of people struggling with mental health difficulties. And unfortunately, often when people come in to meet me, they are at their lowest possible point. It's not like they've walked in on day one, but often they've waited until things are seriously bad to take the step of coming to speak to the doctor. To be clear here, in this video, I'm talking about people with clinical depression, not just with high stress or slightly low mood. So people with symptoms of clinical depression, like a complete loss of enjoyment in life, tearfulness every day, hopelessness, helplessness about the future, and also possibly physical symptoms of depression, like reduced appetite, severe fatigue, poor concentration, or disturbed sleep. In the general menu of options I offer patients, if they are this low, one of them will often be medication. There's this general consensus in my experience that people would generally like to do as much as they can, use as many other strategies as they can, and only turn to medication as an absolute last resort. And the thing is, I'm completely okay with that. That's not wrong. But the other reason people give me for not wanting to trial medication, and I literally do hear this all the time, is that taking a medication in some way means you're weak. Or, in other words, many people I meet feel that taking a medication for their mental health, it's kind of like giving up. Or that you're a failure because you can't do it on your own. You can't pull yourself out of the depression on your own, and therefore you failed in some way. And that's what we need to break down here. So, in my opinion, it's completely fine to do everything possible to address your mental health issues without using medication. But what's not fine is seeing medication as in some way a personal failure. And let me explain why this is important. If we're thinking about the lifestyle changes that we can implement to improve our mood, including things like exercise, mindfulness, socializing, spending more time with friends and relatives, you get it. But the problem with all of those things is that they require a degree of motivation to be able to get going and engage in them. And the problem is that when we're severely depressed and when we feel incredibly low, we lack motivation, or we feel socially withdrawn. We lose interest in our friends and our hobbies. So it can be very, very hard for someone suffering with depression or severe depression to actually start doing the things that make them feel better. I mean, that's one of the key problems with depression, is that in some ways it's downward cycling. The more depressed you get, the less likely it is that you will have the internal motivation and strength to do the things you need to pull yourself out of depression. You try telling someone who's literally at their lowest that they need to start going for a daily run and see how they react. It's probably not going to happen. And this is where antidepressants actually come in. Because antidepressants are not a solution or a fix for depression. And yes, you heard me correctly as a doctor. I'll repeat, antidepressants are not a fix for depression. But what antidepressants can be useful for is to provide a degree of support for a period of time to enable you to engage with the rest of the work that needs to happen for you to recover. And the analogy I would give here is like putting a plaster cast on a broken arm. So if you break your arm, you're going to attend the emergency room and usually end up with a hard plaster cast on. Does the cast itself heal the bone? Of course not. That only happens with time. But the cast provides a degree of stability and protection while the bone mends. Most importantly, if you have a broken arm, a cast lets you do the other things that are necessary for your recovery and long-term well-being. For example, physical therapy, continuing work so you don't lose your job, continuing to care for your family. If you didn't wear the cast, not only would the bone not be able to repair itself, but you wouldn't be able to get on with the other things in life which ultimately are going to keep you fit and well in the long term, because the arm would be too painful. Over time, of course, the bone mends itself and regains the strength and stability, and the cast becomes less necessary. So finally, when the cast comes off, your arm is strong again and able to support you without the external aid. This is, in my opinion, directly comparable to the use of antidepressants in someone struggling with depression. They are something that we can use to improve your mood, improve your motivation, improve your concentration, your energy levels, your focus, and subsequently help you do the things that you need to recover. Whether that's working, looking after your family, exercising, engaging in some proper talking therapy, or whatever. And there's one other thing which is important to bear in mind here. Depression itself causes us to feel very negative about ourselves and often like we are a failure, have failed in some way, or have let ourselves down or someone else down. Often depression is associated with huge amounts of negative self-talk and low self-esteem. Then we add to this the idea that you're a failure if you can't get through it on your own without medication, and you can see where the problem goes. I think here, my job as someone's doctor is to really help people counter that. So I often tell people, if I'm recommending that they may benefit from taking an antidepressant, I tell them that you're not a failure, it's not weak, it's actually a sign of strength that you want to do everything possible within your power to take control of your health and your mental health. That's my personal spin on why you're not weak if you want to take medication for your mental health. And importantly, why for some people, it might be the only thing that helps them break the cycle of depression. So don't judge them. So this channel is very new for me, and the only way that I'm going to learn if it's working for you is if you give me some pure, honest feedback. So if you did find this video helpful, then please subscribe, comment, or even send me a direct message. That way I know that I'm producing the kind of content that is actually helpful for you. And that's the most important thing for me. Next time, we are going to be talking about weight loss medications. Should you take one even if you're going to put all that weight back on again? Obviously, not a simple question, and that's why I'm devoting my next episode to it. Until then, thank you for watching. See you next time.